Hello, everyone, and welcome to the show. This is Evidence in the Green, closing the cannabis research gap. I'm your co-host, LaKeysha Moton,
And I'm your other co-host, Arnell Etienne.
and in this 5-episode podcast, we'll sit down with some of the cannabis industry's leading professionals, each a subject matter expert in their own respective fields.
Over the course of this 5-episode series, we will cover topics like federal and state regulations, optimal study design, how cannabis research can translate into changes in public policy, and much more. We hope you enjoy the show.
For me, it was very important to find a clinician researcher perspective when we have this conversation about the lack of research with medical cannabis. So I wanted to know if you would just start by sharing your experience designing and implementing cannabis clinical trials, specifically in oncology settings.
Sure. Well, yeah, thank you for the opportunity to speak with you today. This is an important question and important topic, and I think as somebody who's been in this journey of cannabis research for probably now 13 years, there have been some ups and downs, and happy to share some of those as we talk more today. I'll kind of give you the start of the journey. It was actually back one of my first studies. I started my new position here at Health Partners. Was actually a study with nabiximols. So that's a drug by the name of Sativex. And at that time, there was a big phase 3 clinical trial that was going on in the US. This was a trial for patients with cancer and pretty severe and pretty refractory cancer pain. So the funny part is, of course, I was never really a PI of studies in fellowship. And so one of my first studies that I was PI on was this nabiximol study. It fit with my goals. And it was an interesting one because it was very complicated, right? Very logistically complicated. I had to get a Schedule 1 DEA license. Never knew even what that was probably before starting the study. We had to meet with DEA agents who I still remember one of the SIV visits, or the site initiation visits, and the DEA agents coming to look at our lockbox facilities for where we're going to store the cannabis. I'm pretty sure he had a gun in his holster, right? And he's sitting there telling me, hey, make sure there's no funny business because I don't want to send Dr. Zylla to jail. So that was my introduction to research. And of course, cannabis research, which thankfully nobody went to jail. Thankfully, the study went fine, and I learned a lot about, frankly, cannabis and how to use cannabis and how to study it, and realized there were a lot of challenges. So, broadly speaking, I'd say over my 13-year journey of now doing this, there's kind of a couple words that sort of come to mind. One is exciting, right? That was kind of an exciting opportunity. It was a little scary, but exciting in the ways that we've been able to get together with some really great collaborators. We've been able to do some groundbreaking things in a field of research that is kind of untapped, really. And most of the people that I come across, patients, clinicians, researchers, are very enthusiastic about this. I mean, I think we realize there's a need out there with how commonplace it is to use. So excitement is definitely there. Frustrating would be another word I use, though. The barriers, like we mentioned, Schedule 1. Funding is a huge barrier, not made any easier with NIH cuts. DEA status, as I mentioned, kind of claiming this is a Schedule 1 drug that has no medical benefits and is highly toxic and highly addictive and all these things, which I disagree with. But those are the barriers that make this, hard and frustrating. And so kind of for all those reasons, research is slow. And I think that's what we found too, it's just a slow process, and you just kind of have to stick with it. But we've been able to do some really exciting things, and I'm happy to share more about those studies.
Awesome. This is very exciting and understandably frustrating as you use the word. So moving right along, I would ask then, how have you managed to use the state Minnesota's medical cannabis program to navigate these challenges or barriers you encounter? Because you've been very successful in the work you've done.
Well, yeah, so I think the nabiximols studies happened. That probably was a 1 or 2 year study from what I recall. And it wasn't until about 2 years into my career here where Minnesota had launched their state cannabis medical program. That was in about 2015. And so that was a time that I started to essentially form these partnerships form collaborations, both with our Department of Health, the leadership that was running the state cannabis program, but also with we have only two cannabis dispensaries at this time. So started meeting with both of those leaders. At the time, they were both physicians who I sort of knew of or knew, a little bit. And really, we just sat down and started having monthly meetings and said, what can we do and how can we study cannabis now? We know there's some barriers, but we know there's opportunity here. And so I think we just basically formed a working group and kind of said, let's get stuff done together. And that started with surveys. It started with one big, relatively large study, which was to look at all the patients who were certified in the state of Minnesota and look at their outcomes of like, what kind of products did they use? What outcomes they were reporting in our state, and it still exists today. Whenever a patient makes a new cannabis purchase through the medical program, they have to fill out a very simple like questionnaire about their symptoms and what they're using, things like that. So problem is the state was not set up to do research. That's not the funding that was given to it, which is maybe one of the suggestions for future is making sure we have ways to fund the state programs and make sure there's a research component that can be, distributed to people doing interesting questions. But anyway, so we used some of the data that was being collected anyway and published a really nice report about kind of how patients with cancer, indications did. But it was really kind of on the heels of that, and really at the same time that we said, let's figure out a way to do a clinical trial, right? Let's figure out a way to use the fact that we can access cannabis through the state program. We don't have to control it, hold it, get a Schedule I DEA license. Let's figure out a way to randomize patients within the confines of the state program. And so that's, I think, where we've been really successful. And we've done it for a study that we called CANCAN, which was our first study. That study was just essentially enrolling anybody with stage 4 cancer who was on an opioid. And that was the eligibility criteria. So it was a lot of different cancers, a lot of different types, different stages of their treatment. And so the outcomes were hard to, analyze because of course everybody's different to begin with, but we showed we could do the work, right? We showed we could randomize patients.
Yeah.
We showed that we could work with the state dispensaries, that we could work with the Department of Health, and the patients would do this, right? And of course, the nice thing was at the time, the companies were providing the product for free to the patients who were in the study. So that was nice because, again, cannabis expense is huge, right? For people, a lot of people can't afford $200, $300 a month. So we took that out of the equation for the trial, and I think that made it a big success too. So, so anyway, so that's kind of how we got that trial up and running. We've kind of been successful at doing different studies of different iterations since that time in a similar way.
Awesome. So how has your work with the clinic helped to translate that research into practical patient care?
So the CAN-CARE clinic, a lot of acronyms, is different from our CAN-CAN study. So CAN-CAN we kind of described as our cannabis and cancer, just a general term, and that was our study. We then, we're going to fast forward now a number of years back to now 2021 or so, is as we were doing these studies, as we were writing papers and we were getting basically to become more experts in this area, we started realizing like, patients are asking about cannabis all the time. Like, I can't do a study all the time for every patient, but we can provide education in a more formal and structured manner. Essentially, what I did is I said, let's create a cannabis education clinic. We call it a cannabis research and education clinic, CARE, Cannabis Research and Education. But basically, it was more so the education piece. So basically, if a patient of any of my partners in my practice, and there's about 30 or so on oncologists, they all don't have the time or really expertise to understand cannabis. So we said, well, let's do it for you. I've trained 2 at the time. Now we have 3 advanced practice clinicians running the clinic. It's a virtual clinic, so nobody has to come in person. It's all just education we do on the video. And essentially it's doing what we were doing before, which is to say, hey, here's how the state program works. Here's where symptoms that we see could be controlled. And more importantly, I think here's how to use cannabis in a safe and effective and in some ways cost-effective manner, right? We want to use low doses as low as we can because you're paying for it, We want to titrate up slowly because that's kind of how you know, appropriately give cannabis. And then we've just gotten more and more experience with the different products, what, you know, who does what, how do they do with, you know, different things. And then a portion of our cannabis clinic I designed specifically to collect data, right? So we have essentially like a registry of those patients where we ask them an intake form, an intake survey about their cannabis history, cannabis use history, if they've ever used it, some things about their cancer history. So there's, you know, it's documented there. And then we do ask them every 2 weeks to fill out a quick symptom questionnaire to ask, you know, hey, how's your sleep? How's your pain? How's your nausea? And so we've collected some longitudinal data over the years. It's not perfect data, but it's better, I think, even than the state's data. And we have now seen close to, I think we're nearing 600 patients that we've done consults for. And many of those then do have a follow-up visit with the APC, usually about 4 to 6 weeks after they've started cannabis.
You mind talking a little bit about how you approach balancing the requirements in in your research designs?
Yeah, well, there's an interesting one that just came up today. So this is real time. We have a current study right now that's going really, really well. It's called CANPAN, and basically it's our CAN-CAN study, but just version 2. And what version 2 means is it's only for patients with newly diagnosed pancreatic cancer. So now our patients are all nearly identical. They're all about to start chemo, so they're all kind of a similar sort of pattern, much like you'd see in a typical clinical trial. And that study is going really well. We're looking for about 32 patients. We opened it in mid-September, and we're about 6 months in, and we already think just today we enrolled our 23rd or 24th patient, which for one institution, one organization, that's pretty rapid accrual to a clinical trial. So it's going so well, and this is a study I've partnered this particular study with a colleague, a really close colleague at the University of Minnesota, who's a GI oncologist, a medical oncologist who specifically sees pancreatic cancer and a lot of it. He's very excited about this work. His name's Dr. Arjun Gupta, and he's been a phenomenal advocate for the study, not only in the design and getting it up and running, although we're only running it out of our organization. Some of that is actually a strategic decision because the university, and I love the University of Minnesota, did all my training there, they're slow and they're cumbersome, and it would take forever to get this study open and approved to go through that mechanism. So we said, let's just open it at our one organization, which we've already done the work. We've already proven to our IRB that we know what we're doing and it works and it's all okay. Anyway, so, but what we do is we get referrals from Dr. Gupta. So he sends us patients who are interested in the study. They can continue to do their chemo at the University of Minnesota, but we do the study portions, you know, here in the surveys and, you know, some of the things. So it's worked really, really well. Again, back to partnerships. You got to have good partners and collaborators to get research done. There's just no other way.
What are some strategies or practical considerations you can offer some clinicians that may be interested in cannabis research?
Yeah. Well, again, the first one is collaborate. Get a big group. You know, get a good ideas. A lot of people have better ideas than you, and you have to be open to those. One I haven't really touched on though is I might throw in here is fundraise. You need to diversify where you're getting your research funding from, and it's expensive to do research studies, right? I mean, you can do a little tiny retrospective review article for a couple $1,000, but even our small trials that we're doing kind of bare bones, you know, a 30 patient study is going to cost at least $100,000, right, to do it well and, you know, to conduct it and get stats and analysis and it's probably really more than that, but we've been able to do it pretty low budgets. So you need to find, you know, funding. And again, it's hard to find funding. We actually, a small story back to the cannabis and pancreas cancer project. This was many years ago, before kind of this current era of concern about federal funding, um, that we had a foundation that we had identified who loved our project, loved our trial. They were gonna fund it completely, and at the last minute, they sort of pulled out and said, "Oh, wait, we have some concerns because we have some other federal funds that we get, and we're not sure if we can then give other funds to a federally illegal substance." So
Wow.
that was a real hard one to swallow because we had gotten so far down the road. We really thought we were ready to launch the study in a much bigger fashion. But anyway, so luckily we were able to figure it out. But again, we compiled different pockets of money, and a lot of it has been with philanthropy. I mean, most of my early work would not have been done without, very generous donors. So I think that's something you do have to kind of factor in. And then maybe my third one, probably most important, is you know, start small, but again, don't just settle for like, survey studies and retrospect. Like surveying patients is not going to change the field. It's not going to change, beliefs, especially amongst oncologists. We oncologists are kind of stubborn, right? We get trials of, 500 people, and we can detect a month or two difference in survival. Like they're very big, robust clinical trials, right? And so telling us, oh, well, this survey says this, nobody's going to believe it. So I think we have to do clinical trials. Again, there's the logistical challenges of that with the regulatory Schedule 1 DEA status. But I think doing clinical trials in some way, shape, or form, and ideally including some degree of randomization, which is, again, we've been able to do in some of our more recent studies, I think it's key. You gotta do the right kind of work, even if it's small scale, to be able to change perceptions and change beliefs and attitudes.
Wow. Dr. Zylla, this has been an amazing segment. Thank you so much for all the information that you've offered us here, for all the work you continue to do, the advancements that we understand and are learning about in our program about cannabis therapeutics for the management of cancer pain. So again, I thank you very, very much. And we wish you much success going forward. Yes, sir.
Thank you. No, it's been a pleasure chatting here.
Well, everyone, that concludes our show for today. We hope you've enjoyed the content.
Please note that the views expressed here today are those of the experts and not the Society of Cannabis Clinicians nor the University of Maryland.
I'm your co host, LaKeysha Moton, and we will see you guys next time. Feel free to check out the show notes and the resource links.